Severe symptoms would really signal and point towards an amino acid-based formula. And the reason I say that is in the interest of time. Parents don't have the time to waste, I suppose, really, trialling them on a formula for a few weeks and then coming back to us because the symptoms are so severe and there's a lot going on. But if the symptoms are mild to moderate, and their growth is not that compromised, we would choose an extensively hydrolyzed formula in those cases. In infants under 6 months, we would never use soya-based formulas in our service in Ireland anyhow. Our two choices would really be the extensively hydrolyzed or the amino acid-based. In our practice and in Ireland, we do not recommend goat's milk or sheep's milk or horse milk or any type of other animal milks, simply because there's such a high risk of cross-reactivity between the proteins, between the cow's milk protein and other animal proteins. So we would never recommend those type of milks in our practice to parents. If their symptoms haven't improved on an extensively hydrolyzed formula, the question then is, when do you put them onto an amino acid-based formula? And this really, we would say between 2 to 6 weeks. If their symptoms aren't improving by 2 weeks, we would give them time, but this is especially important in the non-IgE mediated when everything takes a little bit longer. So if they haven't improved after 6 weeks, we would definitely consider moving them over to an amino acid-based formula, and we wouldn't waste time on that. Very often parents would come in and say, "You're probably thinking I'm making this up," or we would never think that at all, because they're the ones in the real life scenario at home with them up all night, looking at their symptoms every day, counting the number of vomits per day. So we would never devalue the parental feedback at all. In fact, they're they're the number one people we should be listening to when we're talking about symptoms and improvement of symptoms. But I'm sure parents, particularly first-time parents, come into us saying, "We've never done this before," but they don't know what to expect because they don't have another child maybe as a reference point. So particularly first-time parents do feel that they're making a big deal out of nothing. But it's a normal thing to have parental anxiety if their baby is not thriving.